Ever tackled a really tough problem, maybe at work, where a solution that looked great on paper completely missed the mark in practice?
Oh, absolutely. Or maybe champion an idea you thought was brilliant and it just fizzled out.
Exactly. You're left wondering why. Well, today we're diving deep into something that helps answer that why. We're talking about realist reviews.
Mm-hmm.
And this isn't just, another academic way to summarize research papers. It's a really powerful lens for understanding how, when, and crucially, for whom things actually work in the messy real world.
That's the key, isn't it? The real world complexity.
Right. And we're drawing our insights today from a fantastic article in BMJ Quality and Safety. It's called When Are Realist Reviews Useful? And What Does a Good Realist Review Look Like? By Claire Duddy and Geoff Wong. It's a really clear guide.
It really is. And what's so fascinating, as you said, is that it pushes us beyond just asking, did it work? The mission here is different.
Different.
Well, it's about developing this really in-depth, explanatory understanding. Think of it like building a blueprint for why things happen the way they do in complex situations. Our aim today is to unpack its core ideas, show you its unique advantages, and hopefully give you a new way to think about tackling complex challenges yourself.
Okay, let's make it concrete. Imagine a large hospital. They've got ongoing struggles with recruiting and keeping staff, right?
Yeah.
A common problem.
It's very common.
They've tried bonuses, wellness programs, maybe restructured things, but the results are, well, all over the place. Mixed at best.
Yep, seen that movie before.
So now they're thinking, maybe we bring in some non-traditional health professionals, like community health workers or social care navigators.
Okay, an interesting idea, but not simple.
Not at all. It's a complex change in an already complex system. They need to figure out why the old stuff didn't stick and, crucially, how this new approach might actually succeed and, under what specific conditions.
And that is exactly where a realist review approach becomes so valuable. It's designed for that kind of puzzle.
Okay, let's unpack that puzzle then. We hear about systematic reviews, meta-analyses. What really makes a realist review different? How does it stand apart?
Great question. Because it is fundamentally different, I'd say there are three key things that really set them apart.
Okay, three things.
First, they are explicitly theory-driven. Now, what that means for you, listening, is their main goal isn't just to summarize what studies found, it's to actually build and refine what's called program theory.
Program theory. Okay, that sounds a bit academic. Can you break that down? What does that mean in practice?
Yeah, fair enough. Think of it like this. A program theory is the story or the blueprint of how an intervention is supposed to work. Not just what it aims to achieve, but the step-by-step causal pathways, the how and why behind it.
Ah, okay, so the underlying logic model, almost.
Exactly. It's about uncovering those hidden causal mechanisms. That's very different from, say, some qualitative reviews where theory might inform the analysis.
Yeah.
But building and testing that specific explanatory theory isn't the primary output.
Got it. Theory-driven. What's number two?
Number two is their incredible flexibility with data sources. This is a big one.
Flexible how?
Well, many reviews, like Cochrane reviews, are quite strict about including only certain types of studies, often randomized controlled trials, right?
Right, the gold standard for effectiveness.
But realist reviews, they cast a much wider net. They can draw on any relevant data. Qualitative studies, quantitative, mixed methods, policy documents, commentaries, even things like news stories if they shed light on the program theory.
Wow, okay. News stories. That might make some researchers used to strict hierarchies of evidence a bit nervous. How do you ensure quality or, rigor with such diverse sources?
That's a really common concern and a good one. The rigor isn't about excluding sources based on type alone. It's about how you interrogate and synthesize that diverse information. You use each piece of evidence, whatever its form, to test, refine, or even contradict parts of your developing program theory. So a news story might offer insight into a specific context or how people reacted to an intervention in a way a formal study didn't capture. It's about triangulation and building a coherent explanation.
Okay, so the diversity is actually a strength for theory building, if handled right. Makes sense. What's the third differentiator?
The third one is maybe the most fundamental, and it underpins the other two. Realist reviews are based on a specific realist philosophy of science. They focus on something called generative causation.
Generative causation. Okay, that sounds important. What does that mean, practically speaking? How is it different from just saying X causes Y?
It's about going deeper than just correlation or even simple linear causality. Generative causation asks, what is it about the context in the intervention that activates certain mechanisms within people or systems, which then generate the outcome? It's about the how and why.
The engine driving the change, not just observing the car moving.
Precisely. And they use a really handy heuristic, a kind of mental shortcut to think about this. Context plus mechanism, outcome, or C plus MO.
C plus MO, I like that. It sounds like a formula for digging deeper. Let's break that down. What exactly do we mean by context, mechanism, and outcome in this framework?
Okay, let's do it. So context, C. Context is basically any condition or feature of the situation that influences whether a mechanism gets triggered or how it operates.
So not just the place, like a school or a clinic.
No, much broader than that. It can be the physical setting, sure, or demographics. But it can also be things like existing relationships, cultural norms, organizational resources, even people's attitudes or beliefs. Think of expectations of aging or trust in healthcare providers. These are contexts. They're the conditions that enable or constrain mechanisms.
Okay, the relevant background conditions. What about mechanism? This sounds like the core of it.
It really is. Mechanisms are the underlying processes that are triggered by the intervention within a specific context, and that actually generate the outcome. Crucially, they're usually about people's reasoning and responses.
So it's not the intervention itself, like the new training program isn't the mechanism.
Exactly. That's a super common confusion. The training program is the intervention strategy. The mechanism might be something like increased confidence or a new understanding or peer support that the training generates into the participants, which then leads to a change in behavior, the outcome.
Yeah.
Mechanisms are often these hidden internal shifts.
Ah, I see, like the spark that makes the engine turn over. Can you give another example?
Sure. Remember that safety netting review, giving patients advice on what to do if symptoms worsen.
Yeah.
They found that when the information was seen as personally relevant and tailored, that's the context, patients developed a sense of ownership and credibility. That's the mechanism, an internal shift, which then led to adherence to the advice, the outcome. The mechanism is that feeling of ownership.
That really clarifies it. Okay, so context triggers mechanism, which leads to outcome. What counts as an outcome here?
Well, outcomes are the results of the effects. But realist reviews often look beyond just the final intended outcome. They consider a whole chain.
A chain.
Yeah, proximal outcomes, the immediate effects, like a patient understands the advice, and distal outcomes, the longer-term goals, like reduce hospital readmissions. And they also look for unintended outcomes, positive or negative. It's about the whole picture.
Okay, so C plus MO. And you mentioned these configurations, CMOCs.
Exactly. A CMOC, or context mechanism outcome configuration, is basically one specific pathway. It's a statement that says, in this particular context, C, this intervention strategy triggers this specific mechanism, M, leading to this particular outcome.
Like one piece of the puzzle.
Precisely. And the goal of the Realist Review is to identify multiple relevant CMOCs and then weave them together to build that bigger picture, that overarching program theory we talked about earlier.
So it's about connecting those dots, those CMOC puzzle pieces, to see the full dynamic picture of how something works or doesn't work, not just seeing the individual elements in isolation.
You've got it. It moves you from just describing things to actually explaining the causal patterns.
This really brings up the question then, when is this approach most useful? It sounds like it's built for complexity.
Absolutely. That's its sweet spot. Realist reviews are exceptionally valuable when you're dealing with complex interventions, things with lots of interacting parts, targeting different behaviors, rolled out in diverse settings where you see lots of variation in results.
Like our hospital example with staff retention.
Exactly like that. A realist review could help those managers diagnose the specific reasons for turnover in different departments, contexts, identify what might actually motivate different staff groups, mechanisms, and tailor strategies accordingly, rather than just trying another one-size-fits-all program.
So if I'm running, say, a community project and it's working brilliantly in one neighborhood but not another, this could help me figure out the why.
Precisely. Or understanding why a policy works as intended in some regions, but has unexpected negative consequences elsewhere. It helps you unpack that variability. It's been used effectively for things like understanding doctors' prescribing habits or why mental health initiatives work for some but not others.
Okay, so it's great for the how and why in complex situations, but when is it not the right tool? Sometimes you just need to know, does this thing work overall?
That's a critical distinction. Realist reviews are not designed to give you a single number for overall effectiveness across all contexts. They don't average things out.
So not for the question, is drug A better than drug B on average?
Exactly. For that kind of question, you'd want an aggregative review, like a traditional systematic review or meta-analysis, which pools quantitative data to estimate an average effect size. Realist reviews are about explanation, not estimation of a universal effect.
So it's really not about does it work, yes or no, but drilling down into how does it work, for whom does it work best, under what specific conditions, and through what processes.
You've nailed it. Explanation over aggregation. Although, interestingly, they can sometimes be used together.
Oh, how so?
Well, you could do an effectiveness review to see if there's an overall effect, and then use a realist review to understand the variability and the how and why behind that average finding. Some studies have done exactly that, getting the best of both worlds.
That makes a lot of sense. Now, given how nuanced and frankly different this approach is, I imagine people run into challenges or misunderstandings when trying to do or interpret these reviews. What are some common pitfalls?
Oh, definitely. As they've become more popular, which is great, we also see some common issues cropping up. A lot of it stems from trying to apply methods or thinking from other review types without fully grasping the realist philosophy.
Like trying to fit a square peg in a round hole.
Kind of, yeah. A big one is just a fundamental misunderstanding of the core concepts. Things like generative causation, the real purpose of CMOCs, or getting context and mechanism distinct. Sometimes you see reviews that just list a bunch of context, mechanisms, and outcomes separately.
Without connecting them.
Right. They don't build those C plus MLO configurations to show the causal links. It's like listing ingredients but never explaining the recipe. It misses the whole point of configurational thinking.
Okay, so just listing the parts isn't enough. You need the connections. What else?
Another major one, which we touched on, is confusing mechanisms with the intervention itself or the strategies used. Remembering that the mechanism is the response or the reasoning triggered by the intervention, not the intervention activity itself, is crucial but often missed.
Right, the internal spark, not the external action. Got it.
Then there's sometimes a too narrow definition of context, just sticking to demographics or physical location. This really limits the explanatory power. Thinking more broadly about context like perceived risk or organizational culture allows for richer explanations.
That makes sense. It opens up more levers you might be able to influence.
Exactly. And finally, a really important one is the lack of a coherent, overarching program theory. Developing individual CMOCs is necessary, but it's not sufficient. The end goal is to weave these together into a plausible story that explains the intervention as a whole. Without that synthesis, the CMOCs can just feel like a disconnected list of findings.
So the final output should be more than just the sum of its parts. It should be a cohesive explanation.
Precisely. A good realist review tells a compelling causal story backed by evidence.
Okay, so for researchers thinking about using this, or for people like me trying to understand and use the findings of a realist review, what are the solutions? How do we avoid these pitfalls or spot a well-done review?
Good questions. Firstly, proper training and methodological support are really vital. This isn't an easy methodology you just pick up. Understand the philosophy, the concepts like generative causation. It takes time and often guidance from experienced realist methodologists.
So don't try this at home without supervision, basically.
Well, maybe not quite that drastic, but investing in training or collaboration is highly recommended. Our hospital managers, for instance, should look for a team with demonstrated realist expertise.
Okay, training first. What else?
Second, embrace flexibility and iteration. Realist reviews are often a journey of discovery. The initial research questions might evolve, the scope might narrow or broaden as you learn more. The protocol isn't set in stone. It's expected to adapt as the program theory develops. That's a feature, not a bug.
Right, it needs to respond to what you're finding.
Exactly. And third, and this is key for both doing and reading them, use the specific quality and reporting standard developed for realist reviews. The main ones are the RAMESES standards.
RAMESES.
Yes, RAMESES. It stands for Realist and Meta-Narrative Evidence Syntheses Evolving Standards. There are separate guidelines for reporting the review and for judging its quality.
And why is using those standards so important?
Because it's a common mistake to judge a realist review using criteria designed for, say, a Cochrane review. Things like assessing rigor are different.
How so? What does rigor look like here?
In a realist review, rigor isn't primarily about applying critical appraisal checklists to every single included paper, though relevance and trustworthiness are considered. Instead, rigor lies in the plausibility, coherence, and explanatory power of the final refined program theory itself. Does it make sense? Does it account for the diverse evidence? Is it useful?
Ah, so the focus is on the strength of the explanation built, not just the quality score of each individual study fed into it.
Exactly. Criteria like consilience, does it explain all the data? Simplicity, is it as clear as possible? And analogy, does it fit with related knowledge? Are key.
So for listeners reading one of these reviews, what are the quick red flags? What should make them pause and think, maybe this isn't quite hitting the mark of a good realist review?
Good practical question. Be cautious if you can't easily find a clear, overarching program theory. That's the main output. Be skeptical if the CMOCs are just presented as separate lists of contexts, lists of mechanisms, lists of outcomes, rather than integrated causal statements showing how they link together.
So look for the C plus MO connections being explicitly made.
Yes, and definitely watch out for mechanisms being described as if they are the intervention or strategy. If the internal spark is confused with the external activity, that's a sign the core concepts might have been missed.
That's incredibly helpful.
Right.
Wow, what a fascinating deep dive into realist reviews. This really has shifted my perspective. We've unpacked a methodology that offers such a unique lens for getting at the why behind things, especially when dealing with all the complexities of the real world.
It truly does. It provides this potential for a really depth, explanatory understanding of tricky problems. It moves you beyond just observing what happens to building theories about why it happens, which can then lead to much smarter, more targeted solutions. For you listening, it's more than just a research method, it's a way of thinking critically.
It absolutely changes the questions you ask, doesn't it? From what works to that much richer question. What works, for whom, in what circumstances, how, and why. It feels like getting the real operating manual.
That's a great way to put it. So maybe a final thought to leave you with.
Yeah.
As you go about your work, your life, observing the challenges and initiatives playing out around you,
Yeah.
how might consciously trying to apply a realist lens, actively looking for those hidden contexts, trying to infer the underlying mechanisms, those internal sparks, how might that fundamentally change how you approach understanding and maybe even solving the problems that matter most to you?